Okay, so regarding the penicillins are indicated for the treatment of streptococcal infections, including pharyngitis, tonsillitis, scarlet fever, endocarditis, pneumococcal infections, staphylococcal infections, some gonococcal infections. So notice a lot of those bacteria that the penicillin kills are a lot of what? Gram-positive, those above the belt infections. Now, on the next page, they give us a case study. I'm not going to read that whole case study, but basically, it's for a patient that needs a penicillin. They need an antibiotic. They're placed on amoxicillin, right? So one of the assessments we're going to make sure we do is make sure that they're not allergic to penicillin. And whenever we're giving a medication, whatever that medication is that we're giving, we're always going to make sure the patient's not allergic to that medication. Now, when it comes to nursing implementation, again, remember, we're always going to do a culture and sensitivity before we give them the medication, because if we do that CNS afterwards, that medication is going to alter the results of the CNS. Store the suspension where? In the refrigerator. So that's something else that's important to know about penicillin, right? You're going to store it in the refrigerator, shake well before each use. What are you going to teach the parents of the child that's getting the penicillin? Teach them you need to store the drug in the refrigerator. Shake the bottle before each use. Make sure you give that child the entire amount of medication. Monitor your child for any signs of dehydration and try to encourage them to take their medications. Watch out for opportunistic infections such as thrush. Remember that white coating they might get in their mouth? If this occurs, you're going to teach them to consult their healthcare provider. Do not stop taking the drug. So even if they notice the child develops something such as thrush, make sure you call the healthcare provider, but don't stop giving them the drug until the healthcare provider either switches the medication or says to stop. Report any of the following to your healthcare provider: worsening pain, high fever, inability to swallow, lethargy, dry skin, or what does it say from a diaper rash? Severe. Pay attention. Whenever you guys see that word, severe is never normal. Okay? So whenever a patient has something and it's severe, you always have to do something about it. There is going to be a nursing intervention following that. Pharmacokinetics of the penicillins, and I don't go over the pharmacokinetics very often, but if I talk about it, that means it's important to know, okay? They are sensitive to gastric acid levels in the stomach and should be taken on an empty stomach to make sure that it's absorbed properly. On an empty stomach. Cautions and indications. Obviously, we're not going to give it if they're allergic to any penicillins or what? Cephalosporins, because we talked about this last week. If they're allergic to cephalosporins, we're not going to give penicillins and vice versa. You're going to give this with caution to any patient that has renal disease, because if the kidneys aren't working, they're not going to be excreting the medication the way that they should. Excuse me, guys. Adverse effects of penicillin. Common adverse effects: nausea, vomiting, diarrhea, abdominal pain, glossitis, stomatitis, gastritis, sore mouth, and furry tongue. Super infections include yeast infections. They're very common and they're associated with the loss of bacteria from the normal flora. Remember, the normal flora is what keeps certain yeast and fungus from growing. So when the antibiotic kills that normal flora, they just start to grow wild. Hypersensitivity reactions can include rash, fever, wheezing, with repeat exposure to anaphylaxis that can progress to anaphylactic shock and death. Drug-drug interactions. If penicillins and penicillinase-resistant drugs are taken concurrently, that means at the same time with tetracyclines, we see a decrease in the effectiveness of the penicillins. So the tetracyclines decrease the effectiveness of the penicillins. This combination should be avoided as much as possible. Other drug-drug interactions, aminoglycosides. Combinations with aminoglycosides and penicillins should be avoided. Let's jump to page 119, where they're going over nursing interventions and implementations. Now, I don't know why I didn't highlight this, but we talked about this already. Make sure that the patient takes an entire course of medication. All of this we talked about last week. That's why I'm not repeating myself. I'm jumping over here. You're going to monitor the patient for any signs of super infections, monitor the injection sites regularly, teach them to report difficulty breathing, severe headache, severe diarrhea, dizziness, weakness, mouth sores, vaginal itching or sores. So notice, because it says severe, if they have a headache, that's not something that, you should be so concerned about that you should report, right? But if it's a severe headache, we're going to be concerned. Make sure you report it. If you have severe diarrhea, make sure you report that. Box 9.6 on the bottom, patient family teaching. In regards to the penicillins, it's very important to complete the full course of penicillins to avoid recurrence of the infection. And not only can that infection come back, it can come back stronger. The drug should be taken on an empty stomach, not a full stomach, not with food, on an empty stomach with a full 8-ounce glass of water 1 hour before meals or 2 to 3 hours after meals. Do not use fruit juice, soft drinks, milk to take this drug because these foods interfere with its effectiveness. So you're going to take the drug on an empty stomach with water. Common effects of the drug: stomach ache, diarrhea. Notice it said diarrhea, not severe diarrhea. Changes in taste, changes in color of the tongue. You're going to teach the patient to eat small, frequent meals that may help with GI disturbances. Report any of the following to the healthcare provider: hives, rash, fever, difficulty breathing, severe diarrhea. Do not take the medication to self-treat other infections. Take the entire course of the medication, even if you start to feel better. Sulfonomides. Page 120, sulfonomides. Another class of antibiotics. And notice on the table on the bottom, they start with sulfa. Well, the first two does, back to them. So let's look at the cautions, contraindications, and cautions. Any allergy to sulfonamides, you're not going to give it to the patient, right? So you're going to assess them for allergy to sulfonamides, allergies to sulfonylureas, or to thiazide diuretics, because there's cross-sensitivity with those thiazide diuretics, the sulfonylureas. Other contraindications, cautions: pregnancy, renal disease. Use cautiously in the elderly. Adverse effects. Adverse effects associated with the sulfonamides include GI effects such as nausea, vomiting, diarrhea, abdominal pain, anorexia, stomatitis, hepatic injury. Dermatologic effects include photosensitivity, so they need to be careful when it comes to light, and Stevens-Johnson syndrome. Remember, this is very lethal. It's very deadly. This is a severe skin and mucous membrane reaction. So one of the first things you need to be thinking of when you see a test question tells you the patient's on sulfonamide, you better be thinking of Stevens-Johnson syndrome. That needs to be in the back of your mind because this is deadly. Drug-drug interactions. If sulfonamides are taken with anti-diabetic agents, tolbutamide, tolazamide, glyburide, glipizide, or chloropamide, I can't pronounce that word, chloropamide, the risk of hypoglycemia increases. And what can kill a patient faster, hyper or hypoglycemia? Hypo. So we got to be very careful of those drug-drug interactions if the patient's taking the sulfonamide with any of those anti-diabetic agents. When sulfonamides are taken with cyclosporine, the risk of nephrotoxicity rises. So we need to be paying attention to that patient's kidney function. We need to be looking at that urine output, the BUN, the creatinine, the GFR. You're going to examine the skin and mucous membranes for any rash or lesion. We want to get a baseline on that patient because if things start to change on the skin or mucous membranes, we're going to be very concerned with those sulfonomides, right? Teach the patient again to take the entire course of antibiotics. We're going to give the medication on an empty stomach, 1 hour before or 2 to 3 hours after meals with a full glass of water. We're going to teach them to discontinue the medication immediately if they have hypersensitivity reaction, especially what? Steve Johnson syndrome. Very good. We're going to teach them to take small frequent meals. Avoid driving or operating heavy machinery if they have CNS effects such as dizziness, drowsiness. Drink lots of fluids to maintain nutrition and report difficulty breathing, rash, ringing of the ears, fever, sore throat, or blood in the urine. Tetracyclines. These are your list of tetracyclines. Therapeutic actions and indications. They're indicated for the treatment of infections caused by, and you see that entire list. I'm not going to read them all to you, but I highlighted the ones that tend to show up more for testing purposes. Your rickettsia, mycoplasma pneumonia, H. influenza, E. coli. Contraindications and cautions. Any allergy to tetracyclines or tartrazine, pregnancy, lactation. And this is important to know when it comes to the tetracycline. The reasons that it's contraindicated to give to anyone who's pregnant or breastfeeding is because of its effect on the developing fetus, on the bones in the teeth. You need to know that it affects the bones in the teeth. It's contraindicated in patients who have fungal, mycobacterial, or viral ocular infections. Tetracycline should be used with caution in children younger than 8 years old because their bones are still growing, right? Their teeth, the baby teeth are coming out, the older ones are coming out, coming in. Look at what it says, because it can potentially damage the developing bones and teeth. So it's very important for you guys to understand the effect that tetracycline has on developing bones and teeth, okay? Be careful in giving it to patients with liver or kidney dysfunction. Adverse effects, fatal hepatotoxicity. Skeletal effects involve damage to teeth and bones. They said this to us a million times. Drug-drug interactions. When penicillin G and tetracyclines are taken concurrently, the effectiveness of penicillin G decreases. Drug-food interactions. Because oral tetracyclines are not absorbed effectively if it's taken with food or dairy products, they should be administered on an empty stomach 1 hour before or 2 to 3 hours after meals. Here's another case study. Patients placed on tetracyclines. We're going to look, assess them for any allergy to tetracycline. Concurrent use of antacid, iron products, digoxin, or penicillin. We're going to assess them for that. Implementation. Again, you're going to teach them to take the tetracycline on an empty stomach, 1 hour before or 2 to 3 hours after meals. By the way, let me go back to, because I didn't explain this to you. Antacids, iron products, digoxin, it decreases the absorption of the penicillin. That's why we're concerned about it, them taking it at the same time. Teaching for patient taking penicillin, taking tetracycline. Again, you're going to teach them to take it on an empty stomach, 1 hour before, 2 hours after meals. Do not take this drug with food, dairy products, iron preparations, or antacids. It can decrease the absorption. You're going to teach them to take the full course of antibiotics prescribed. Do not say tetracycline. Outdated products can be very toxic to the kidneys. Teach them to report any of the following to the healthcare provider: changes in the color of their urine or stool, severe cramps, difficulty breathing, rash or itching, or yellowing of the skin or eyes. Page 126. Implementation and rationales. Again, teach them to take the full course of antibiotics. The oral drugs should be taken 1 hour before or 2 hours after meals with a full glass of water. Concomitant use of antacids or salts should be avoided because they interfere with the drug absorption. Do you guys notice how the office is telling you the same thing, just a million different ways? Discontinue the drug immediately if hypersensitivity reactions occur. Teach them to eat small, frequent meals that help with GI distress. Encourage them to wear sunscreen and wear clothing to protect their skin from the sun. That's been seen on NCLEX very often. Make sure you know that. Drink lots of fluids, maintain nutrition, use of sunscreen and protective clothing, straw brim hat, long sleeves, don't wear shorts, wear long pants. Know when to report dangerous adverse effects such as difficulty breathing, rash, itching, watery diarrhea, cramps, changes in color of urine and stool. Key points: tetracyclines can cause damage to developing teeth and bones, and they should not be used with pregnant women or children. You're going to monitor the patient for GI effects, bone marrow depression, rash, and super infections. Next, antimicrobacterials. Antimicrobacterials, these are medications to treat tuberculosis, leprosy. We don't see that much anymore, but still, those are anti-TB, anti-leprosy drugs. Okay. All right, let's talk about anti-TB drugs. TB, tuberculosis. This can lead to serious damage in the lungs, GU tract, bones, and meninges. Because Mycobacterium tuberculosis is so slow growing, the treatment must be continued 6 months to 2 years. Now, for testing purposes, when NCLEX asks you about it, the choices they usually give you, it's going to be way out of the realm, and the correct answer is 9 months, because they usually, even though the book says between 6 months to 2 years, the time span, the average is about 9 months. 9 months is the minimum for NCLEX. Using the drugs in combination helps to decrease the emergence of resistant strains and to affect the bacteria at various phases during their long and slow cycle. And so that's why when it comes to tuberculosis, you get a cocktail. It's not like it's just one medication. The first line, whenever you're studying and you see them telling you first line drug, first line treatment, that's always important. Okay, so the first line drugs for treating tuberculosis is your isoniazid, that's your INH, important to know, and NCLEX ask you about it. Your rifampin, pyrazinamide, and then here's the other ones. You guys read it on your own. I'm not going to try. Oh, I tried to pronounce them. Yes, I am. Ethambutol, streptomycin, and rifampicin. Make sure you know those are your anti-TB meds, okay? Let's go back to table 9.8. These first line drugs are the ones you'll most likely see on NCLEX if they ask you about TB. Ethambutol, you definitely will ask about I hate this. Thank you. These 1, 2, 3, 4. Rifampin and pyrazinamide. I hate it. Okay, you guys put stars next to them? Okay. Therapeutic actions and indications. The anti-TB drugs are always used in combination to affect the bacteria at the various stages to help decrease the emergence of resistant strains. Contraindications and cautions. Obviously, if they have any allergy to the medication, severe renal or hepatic failure, if they're pregnant, if an anti-TB regimen is necessary during pregnancy, the combination of isoniazid, ethambutol, and rifampin is considered the safest. So these three are what they're going to get if they're pregnant. Adverse effects. Rifampin, rifabutin, and rifapentin, those three cause discoloration of body fluids from urine to sweat and tears. NCLEX asks about this many times as well. Make sure you know it. So if it causes the discoloration of the body fluids, guess what? That patient that wears contacts, for the time they're taking that medication, they can't wear contacts, they can wear glasses because even your lacrimal glands will turn orange. It'll change the color of the urine, of the sweat. It can stain the clothes. You have to teach them this in advance. Alert patients that in many instances, orange tinged urine, sweat, and tears may stain clothing and permanently stain contact lenses. This can be frightening if the patient is not alerted to the possibility that this can happen. The newest drug in this group, betacholine, has a black box warning that increased risk of death has been reported when this drug is used, so the drug should be reserved for use when no other drug is effective. So we have to have tried everything else, and none of them are effective. That's when they're going to go to that betacholine, okay? That drug can cause QTC intervals that can be increased when the drug's used. So a baseline ECG should be done before the patient started on that medication so we can have a baseline. Drug-drug interactions. This also has been seen on NCLEX very often, make sure you know it. When rifampin and INH are used together in combination, the possibility of toxic liver reaction increases. The patient should be monitored closely. These medications are extremely hard on the liver. So you're going to be looking at those LFTs. Patients taking betacholine should avoid any other drugs that prolong QTC interval because that medication itself prolongs QTC interval. That's why we're doing that EKG before we even put them on this medication to get a baseline. So you think it'd be a good idea to give them another medication that does the same thing, you're going to kill them. Let me stop here for a second because this is, you guys take a med surg at the same time, right? Okay, good. So something you guys need to know for med surg, I promise you'll see it. Tuberculosis, this is a public concern, okay? And so patients who the nurse even suspects is not being compliant, the state will pay a nurse to come down and go to that patient's home or wherever they are and watch them take that medication. They will give that patient the medication, make them say, check the cheeks, make sure they didn't cheek the medication. Okay, patient doesn't have a choice when it comes to TB medications, whether they want to take it or not. They don't want to take it, guess what? You're going to get directly observed therapy where the nurse comes and gives it to you and make sure you take that medication. Make sure you guys read all of this. But let's go to page 130. Important things to keep in mind. You're going to teach a patient while they're on these anti-TB medications, use barrier contraceptives. And when the author says barrier contraceptives, what do they talk about? Condoms, very good. Use barrier contraceptives and understand that hormonal contraceptives may not be effective if antimicrobials are being used. You will mess around and get pregnant if you think you're going to take those birth control pills on these medications. Understand that normally some of these drugs impart an orange stain to the body fluids. If this occurs, the fluids may stain clothing and tears may stain contact lenses. Report difficulty breathing, hallucinations, numbness and tingling, worsening of condition, fever, chills, or changes in color of urine or stool. Key points. Anti-TB drugs are used in combination. When they're given as cocktails. It's not gonna be just one medication because they're trying to kill that bacteria in the different stages of growth. Adverse effects include rashes, orange tint to body fluids, and GI reactions. All right, 5-minute break, and then we'll start on antivirals. Okay, antiviral agents. Some key terms you guys need to know. Page 141. AIDS severely depresses the immune system. Cytomegalovirus, DNA virus that accounts for many respiratory, ophthalmic, and liver infections. The helper T cells, they help initiate immune reaction. Hepatitis B, you need to know that this is transmitted primarily by body fluids. Hepatitis C, you need to know that it's mostly seen in hepatitis after blood transfusions. When it comes to the hepatitis, it's for testing purposes for NCLEX. If they ask a question about hepatitis, one of them usually they want to see if you know the difference of how they're transmitted, hepatitis B versus C. They ask for about the most. Herpes DNA is a virus that causes lots of diseases, including shingles, cold sores, genital herpes, and encephalitis. HIV, retrovirus that attacks the helper T cells and can lead to AIDS. Sure you know influenza A. Interferon, it blocks viral replication. Need to know that. Virus is a particle of DNA or RNA. It invades a cell to alter its functioning. Make sure you know these key terms. Next page, 142. Your first drug card for me. I didn't forget about them. It's going to be, this is number 1, the agents for influenza and respiratory viruses. Specifically, what you guys, for testing purposes, you're asked about the most is oseltamivir, ribavirin, zanamivir. But make sure you have all of these on your drug cards, okay? Number 2, second drug card I want from you. The agents for herpes virus and cytomegalovirus. Especially acyclovir. All right, so it looks like for this chapter, I only want 2 drug cards from you. All right, so viruses. Viruses can cause a variety of conditions ranging from warts. Yeah, warts are of a viral nature, to the common cold and flu, to diseases such as chickenpox, measles, and AIDS, all of them of which are of viral nature. Interferons. Remember, that's one of the terms you guys need to know. Interferons are released by the host in response to viral invasion of a cell and act to prevent the replication of that particular virus. So it doesn't kill the virus, but it works to prevent the replication of it. Viruses that respond to some antiviral therapy include influenza A, And some respiratory viruses, herpes viruses, cytomegalovirus, HIV, AIDS, hepatitis B, hepatitis C, and some viruses that causes warts and certain eye infections. Let's look at this box, drug therapy across the lifespan. Let's start with children. Children are very sensitive to the effects of most antiviral drugs, and more severe reactions can be expected when these drugs are used in children. Acyclovir for virus is the drug of choice for children with herpes virus or cytomegalovirus. Acyclovir. Dose should be lowered according to body weight, and children must be monitored very closely for adverse reactions on the kidneys, bone marrow, and liver. Look at this. I put a star next to it. Make sure you know it. Patients with HIV infection who are taking antiviral medications need to be taught that these drugs do not cure the disease, that opportunistic infections can still occur, and that precautions to prevent transmission of the disease must still be taken. Women of childbearing age must be advised to use barrier contraceptives if they're taking any of these drugs. Here's another one. You can see it on NCLEX. I put a star next to it. You better make sure you know it. Women with HIV infection should not breastfeed. Older adults. Older patients may be more susceptible to the adverse effects with these drugs, and they should be monitored much more closely. Agents for influenza A and respiratory viruses. Oseltamivir, that's your Tamiflu. And then they give you the list of the others. Make sure you know them, have them on your drug card. Let's jump over to contraindications and cautions. Women of childbearing age should be advised to use barrier contraceptives if they're taking ribavirin. The drug's been associated with serious fetal effects. Oseltamivir, that's your Tamiflu. Usual indications, treatment of uncomplicated influenza, but look at this, guy. For a patient who's symptomatic for less than 2 days. So if they come in, they got symptoms of the flu and they're tested and it's influenza A, but they've had these symptoms for 4 days. That's more than 2 days, right? So it's most effective when the patient's been symptomatic for less than 2 days. Adverse effects. Peramivir has been associated with serious skin reactions, including Stevens-Johnson syndrome and erythema multiforme. Drug-drug interactions. Patients taking Rimonidine may also experience a loss of effectiveness of aspirin and acetaminophen if they're being used. The use of ribavirin should be avoided if the patient's also taking a nucleoside reverse transcriptase inhibitor, that's your NRTI. The combination should be avoided. Live attenuated nasal influenza vaccine should not be used within 2 weeks before or 48 hours after peramivir to avoid adverse reactions. Nursing considerations for the patients taking agents for influenza A and other respiratory viruses. You're going to assess for contraindications and cautions such as allergies to the antivirals. Check them for liver or renal dysfunction. You're going to do a physical assessment on the patient to get a baseline. You're going to assess them for orientation and reflex. Start the drug regimen as soon after exposure to the virus as possible, usually within 2 days of the start of symptoms. Administer influenza A vaccine before the flu season begins. Administer the full course of the medication. Provide safety provisions. Teach the patient to change position slowly. Avoid driving in hazardous tasks. Avoid operating heavy machinery. Key points. A virus must enter a human cell to survive. Next, agents for herpes and cytomegalovirus. Herpes viruses account for a broad range of conditions, including cold sores, encephalitis, shingles, genital infections. Cytomegalovirus, although slightly different from herpes virus, can affect the eye, respiratory tract, and liver react to many of the same drugs. You guys notice I keep putting a star and NCLEX next to acyclovir. Make sure you know all of these drugs though. I don't write NCLEX. Table 10.2, agents for herpes virus and cytomegalovirus. So acyclovir usually given for herpes virus infections. Famciclovir usually given for herpes virus infections, such as herpes zoster, shingles, genital herpes. Valacyclovir treats herpes zoster, recurrent recurrent genital herpes, cold sores, chickenpox. Research has shown that they're very effective in immunocompromised individuals, such as patients with AIDS, those taking immunosuppressants, elderly patients, and those with multiple infections. Contraindications and cautions. Drugs indicated for the treatment of herpes and cytomegalovirus are highly toxic, and they should not be used during pregnancy or lactation. You're going to avoid in patients with known allergies and in patients with liver or renal disease. Adverse reactions. The adverse reactions most commonly associated with antivirals include nausea, vomiting, headache, depression, paresthesias, neuropathy, rash, hair loss. Drug-drug interactions. The risk of nephrotoxicity, so we're concerned with the kidneys. The risk of nephrotoxicity increases when agents indicated for the treatment of herpes and cytomegalovirus are used together with other nephrotoxic drugs, such as aminoglycoside antibiotics. Remember the aminoglycosides? They're hard on the kidneys and the ears. Okay. You're going to assess the patient for orientation reflex, examine their skin, evaluate their renal function. You're going to administer the drug as soon as possible after the diagnosis has been made. Make sure they're drinking lots of fluid, ensure good hydration, ensure that the patient takes a complete course of medications. Look at this. Wear protective gloves when applying the drug topically because you don't want to seep it into your skin. Provide safety precautions such as appropriate lighting, handrails, orientation, assistance. Warn the patient that GI upset, nausea, and vomiting can occur. You're going to make sure you're looking at the BUN, the creatinine, the GFR. You're looking at the urine output because it can affect the kidneys. Instruct the patient about the drug. Provide the following patient teaching. This patient teaching has been seen on NCLEX as select all that applies. Make sure you know the patient teaching. What are you going to teach them? Avoid sexual intercourse is, look at this, guys, if herpes is being treated because these drugs do not cure the disease. Now, did it say avoid sexual intercourse when you have an outbreak? That's not what it says, right? It says avoid sexual intercourse if genital herpes is being treated. Why? The drug does not cure the disease. Okay, wear protective gloves when applying topical agents. Avoid driving in hazardous tasks if dizziness or drowsiness occurs. Key points. These antiviral drugs are associated with GI effects such as nausea, vomiting. They can cause confusion, insomnia, and dizziness. All right, we're moving on to agents for HIV and AIDS. HIV attacks helper T cells. Loss of helper T cell function causes AIDS and AIDS-related complex. Diseases are characterized by the emergence of a variety of opportunistic infections and cancers that occur when the immune system is depressed and is unable to function properly. A combination of at least 3 different antiviral drugs is used to attack the virus at various points in its life cycle to achieve the maximum effectiveness with the least amount of toxicity to the patient. These types of antiviral agents that are used to treat HIV infections are, and it gives you the list, make sure you know them. Page 153. NRTIs, non-nucleoside reverse transcriptase inhibitors. These have direct effects on the HIV virus activities within the cell. Contraindications and cautions. You see, I put a star in NCLEX next to this, make sure you know it. It is suggested that women should not breastfeed if they're infected with HIV. Adverse effects. Adverse effects most commonly experienced with these drugs are GI related, such as dry mouth, constipation, diarrhea, nausea, abdominal pain, dyspepsia. Dizziness, blurred vision, and headache have also been reported. Drug-drug interactions. Life-threatening effects can occur if Deliverance is combined with antiarrhythmics, clarithromycin, dapsone, anti-TB drugs, calcium channel blockers, the list goes on, warfarin, quinidine, indinavir, I did that wrong, but you guys did the drug, sequanavir, and dapsone. These combinations should be avoided if at all possible. The NRTIs, I think any pharmacist ever listening to one of my recordings will want to kill me. The NRTIs were the first class of drugs developed to treat HIV infections. Contraindications and cautions. Of the nucleosides, zidovudine is the only agent that's been proven to be safe during pregnancy. Zidovudine, that's the only one that's safe for pregnancy. 1 second, guys. All right. What was I? Oh, thank you. Women infected with HIV are urged not to breastfeed. My goodness, how many times have they said this? You think that's not going to be a test question? You know I'm going to put that on your quiz. When's your next quiz? Next week, right? Okay. Don't be so excited about it. Adverse effects, serious to fatal hypersensitivity reactions have occurred with Abacavir, and it must be stopped immediately at any sign of hypersensitivity reaction. And then in parentheses, they tell you what those reactions are. fever, chills, rash, fatigue, GI upset, flu-like symptoms. That looks like a beautiful select all that applies to me. I'm just saying. Drug-drug interactions. Severe toxicity can occur if avasivir is combined with alcohol. Do we ever take any medications with alcohol? Absolutely not. This combination should be avoided. Protease inhibitors. This math we're going to do after lunch. Aw, caution. Cautions and indications. Patients receiving darunavir, someone pronounce the drug for me. Darunavir may be at risk for developing diabetes or hyperglycemia and may require dosage adjustments if being treated with anti-diabetic drugs. So if a patient is already diabetic because they're taking anti-diabetic drugs, if they take that medication, darunavir, it may make it even worse, give them hyperglycemia. Darunavir is also associated with mild to severe dermatologic reactions, including Stevens-Johnson syndrome, and the drug should be stopped if severe reaction develops. Adverse effects. As with other antivirals, patients taking these drugs experience GI effects, including nausea, vomiting, diarrhea, anorexia, and changes in liver function. Page 159. Nursing considerations for patients taking agents for HIV and AIDS. You're going to test them for contraindications and cautions, such as a history of allergy to the antiviral. You're going to do a physical assessment so you can have a baseline on the patient, assess the level of orientation and reflex, assess their skin, do vital signs, including the temperature. You're going to evaluate the hepatic and renal function. Look at this. Check results of a CBC count with differential to monitor bone marrow activity and helper T cell number to determine severity of disease and indicate the effectiveness of drugs. Because if that drug's being effective, we should start seeing those numbers go down. Let me rephrase that, because what I said is not true. If it's being effective, then we should see we should not. So for the bone marrow, looking at the platelets, looking at the WBC, looking at the RBCs, those numbers should be stable or should be going up. They should not be going down, excuse me. Everyone heard what I just said? And the T cell numbers should be going up. They should be stable. They should not be going down. I just corrected myself. Everybody heard that, right? Okay. That's what happens when I get too excited. I talk too fast. All right. You're going to check their renal and hepatic function. Make sure the patient takes the entire course of medication as prescribed. Teach them that they need to. Administer the drug around the clock if indicated. Monitor nutritional status if GI effects are severe and take appropriate action. Why? Because even if they're vomiting, even if they have diarrhea, that's even more reason that we need to make sure that their nutritional status is good, because they're going to be losing fluids and electrolytes that must be replaced. Teach them small, frequent meals. Whenever there's GI problems, small, frequent meals. Teach them to stop the drug if rash occurs. Remember, we're especially concerned about what? Stevens-Johnson syndrome. Very good. Teach safety precautions, use of side rails, appropriate lighting, orientation, assistance. Provide the following teaching. Teach them to have regular medical care. Set up a regular schedule for taking all of their drugs at the correct time. Make sure they're keeping up with their tests for the liver and the kidney. Realize that GI upset, nausea, vomiting can occur, but the efforts must be taken to maintain adequate nutrition. Avoid driving or operating heavy machinery if they have CNS symptoms such as dizziness. Report extreme fatigue, severe headache, difficulty breathing, or severe rash to the healthcare provider. Look at box 10.7, antidiarrheal drugs for the patient on antiretroviral agents. One of the potentially serious adverse effects of antiretroviral drugs is diarrhea, which can lead to dehydration, skin breakdown, and infection. So here's another case study about a patient with where they've been placed on. Okay, so he's getting a cocktail of these antiretroviral drugs. On page 161, you're going to remember to check the CBC and differential, provide safety measures such as good lighting, teach them not to get up by themselves so you can assist them, small frequent meals. You're going to be monitoring for opportunistic infections. Provide patient teaching such as the name of all of their drugs, when they're supposed to take those drugs, the side effects of the drugs. Key points. The HIV virus infects helper T cells. We've seen that a million times. And that leads to a loss of immune function and the development of opportunistic infections. Patients taking drugs to treat HIV need to take all of their medications continuously as prescribed. Next, anti-hepatitis B agents. Hepatitis B is a serious to potentially fatal viral infection of the liver. The hepatitis B virus can be spread by, this is important, you guys see I put star next to it and NCLEX next to it. How can it be spread? By blood or blood products, sexual contact, or contaminated needles or instruments. Famous test question for this, so you'll get a test question about a teenager that just turned 18 and they're excited and they came in for their annual physical. And they were talking to you about, certain things they're going to do now that they have freedom. What are some teaching you're going to do? And what in a list of things that the teenager told you, they're so excited about getting a tattoo. So you better be doing teaching and making sure that that patient has been vaccinated for hepatitis B, because teenagers don't tend to make the wise decisions, right? They don't think things through, and we don't want them to go somewhere where they're using dirty needles and they contract hepatitis B. Does that make sense? Healthcare workers are especially at high risk for contracting hepatitis B due to needle sticks. Contraindications and cautions, we're going to assess them for any allergy, breastfeeding, pregnancy, renal or kidney dysfunction, renal or liver dysfunction. Adverse effects of anti-hepatitis B medication. The adverse effects most frequently seen: headache, dizziness, nausea, diarrhea, and elevated liver enzymes. The elevated liver enzymes part, NCLEX definitely expects you to know that. It's very, very, very hard on the liver. You're going to be looking at the ALT, the AST. Hepatitis B treatment. And over here, I wrote never stop abruptly. You need to stress the importance of not running out of the medication and using extreme caution when discontinuing the use of Adefovir. Drug-drug interactions. There's an increased risk of renal toxicity if these drugs are taken with other nephrotoxic drugs. Implementation rationale for the patients taking anti-Hep B agents. Withdraw the drug and monitor the patient if he or she develops signs of lactic acidosis or hepatotoxicity. Why? Because hepatitis B and these drugs are very, very, very hard on the liver. Caution the patient not to run out of the drug. Don't wait until it's time for the refill and you don't have any more of the medication that you're trying to get refilled. Do not run out of the drug. Advise women of childbearing age to use barrier contraceptives. They cannot get pregnant. They can't take this medication during pregnancy. Advise women who are breastfeeding to find another method of feeding the baby while on this medication. Advise patients that these drugs do not cure the disease. Remember, guys, with viruses, we can treat the symptoms, right? We can try to keep them from replicating. We can wait for it to pass, but they're of a viral nature. So you have to tell them these medications are not going to cure the disease. There's still a risk of transferring the disease. You're going to provide the following teaching. Teach them to have regular blood tests, keep up with their medical follow-up, avoid running out of the medication. Realize that most likely they are going to get GI upset, and GI upset is not reason enough to stop taking that medication. Report severe weakness, muscle pain, palpitations, yellowing of the eyes and skin, trouble breathing. Key points. Hepatitis B is a serious to potentially deadly viral infection of the liver. Again, it's spread by blood or blood products, sexual contact, or contaminated needles or instruments. Hepatitis B used to be treated only with interferons and rest. Entecavir, adefovir, and telbivudine are antivirals that are now available for the treatment of hepatitis B. All right, so that was hepatitis B. Now we're moving on to hepatitis C. And again, you guys need to know the difference in the modes of transmissions of hepatitis B versus hepatitis C. Now, hepatitis C, most liver transplants performed in the United States are due to progressive liver disease caused by hepatitis C infection. People can get hepatitis C in a number of ways, including, you need to know this list, exposure to blood that's infected with the virus, being born to a mother with hepatitis C virus, sharing a needle, having sex with an infected person, sharing personal items such as razor or toothbrush with someone who's infected with the virus, or from unsterilized tattoo or piercing tools. Contraindications and cautions. Any allergies to the medication, pregnancy, lactation. Use with caution when administering the drug to patients with severe liver or kidney disease. Nursing considerations for patients taking anti-hepatitis C agents. Ensure that the patient is also receiving Pagantepron and ribavirin or other hepatitis C drugs. You're going to monitor the liver function. You're going to advise women of childbearing age to use a barrier contraceptive. You're going to advise women who are breastfeeding to find another way to feed the baby while they're on this medication. Advise patients that these drugs do not cure the disease. There's still a risk of transferring the disease. You're going to teach them to have regular blood tests and follow-ups. Always take this drug with peginterferon and ribavirin. Realize that GI upset is going to occur. Report severe changes in color of urine or stool, rash, or lethargy. Summary. Influenza and respiratory viruses cause the signs and symptoms of the common cold or flu. Herpes virus and cytomegalovirus are DNA viruses that cause a multitude of problems, including cold sores, encephalitis, infections of the eye and liver, and genital herpes. Helper T cells are important for maintaining a vigilant, effective immune system. HIV, which specifically attacks helper T cells, they can remain dormant, but the most important things you guys need to know with HIV, they attack the helper T cells. And 3 drugs have been approved to treat hepatitis B infection: adefovir, entecavir, and telbivudine. All right, 5 minutes break, and we'll do the last chapter. Okay, antifungal agents. The third drug card I want from you are going to be your azole antifungals, such as fluconazole, ketoconazole. Notice they most of them end in the azoles, so that's going to be number 3. Number 4, your other antifungals, such as amphotericin B, nystatin, and number 5, your azole topical antifungals, such as ketoconazole. So you guys will only owe me 5 drug cards next week.
Professor E, I've got a question on the drug cards. Do we put all the dosages down for each individual medicine?
No, when it comes to dosages, guys, unless when I'm teaching, if I go over that specific dosage, that means you guys need to know it. But for the drug cards, no, unless I specifically talk about it.
Thank you.
However, the least say the point that exactly the one say the dose. Exactly.
I know, but when I went over it, I told you guys, like there's certain drugs, like for example, the pediatric acetaminophen, that you need to know. But unless. All right, guys.
These now is the medications that say.
So for example, the third drug card, guys, the third drug card that you're going to give me is going to be the azole antifungal. You need to list all of this on that drug card. Then give me, you know, what the contraindications, what the drug. All right. Let's start with the azole antifungal. The azoles are a large group of antifungal drugs used to treat systemic and topical fungal infections. Therapeutic actions and indications. They bind to sterols and can cause cell death, that's fungicidal effect, or they can interfere with cell replication, that's fungostatic effect. Remember the difference between cyto and static? I think that was one of your test questions. Let's look at this table. Fluconazole, that's your diflucan. Indication, treatment of candidiasis. Ketoconazole reduces the scaling of dandruff. Use a shampoo. Other antifungals such as amphotericin B. Use is reserved for progressive, potentially fatal infections. So that amphotericin B, we kind of go to this when nothing else is working. Griseofulvin treats ringworm or tinea infections. You see, I put a star and NCLEX next to it. You need to know that. Tinea corpus, so that's the fungal infection. That's a ringworm on the body. Tinea pedis on the feet. Tinea cruris, just cruris. Is that the groin one? In the groin, right? Right here? Yeah, cruris, that's the groin. Tinea barbae, here, your beard area. Tinea capitis, head. And inguium. Which one is inguium? Somebody look this up for
in the nail.
in the nail. Oh, thank you. Unguium. I don't know. UNGUIUM. That one. That's the nail. The nail fungus. Thank you. NCLEX expects you to know difference. Make sure you know them all. Okay. Nystatin. Vaginal candidiasis, and this is often, you see this often in peds, we give them for diaper rash. All right, pharmacokinetics. Ketoconazole. Ketoconazole available as a shampoo and a cream. Contraindications and cautions. Ketoconazole has been associated with severe hepatic toxicity and should be avoided in patients with hepatic dysfunction. Should be used in caution with anyone with liver or renal impairment. Drug-drug interaction. Itraconazole has a black box warning regarding the potential for serious cardiovascular effects if it's given with lovastatin, simvastatin, triazolam, midazolam, pimozide, oh gosh, or dofetilide. Those combinations should be avoided. Contraindications and cautions: pregnancy, lactation, hepatic impairment, renal dysfunction. Adverse effects: andaldofungin and caspofungin are associated with hepatic toxicity and liver dysfunction. They can cause bone marrow suppression. Other antifungals. You guys need to know these other antifungals, including the amphotericin B. And remember, with amphotericin B, because of its toxicity, we really save this after we've tried the other antifungals, and they have to work, okay? Amphotericin B is a very potent drug with many unpleasant adverse effects. You guys can go over all those adverse effects on your own. Contraindications and cautions. Amphotericin B has been successfully has been used successfully during pregnancy, but it should be used cautiously. It crosses into breast milk and should not be used during lactation. Extreme caution is needed in the presence of renal impairment. Toxicities associated with serum levels higher than 100 micrograms per milliliter. Adverse effects. Has adverse effects on the liver and kidneys, bone marrow suppression, rash and dermatological changes. Amphotericin B is associated with severe renal impairment, bone marrow suppression, GI irritation, nausea, vomiting, potentially severe diarrhea, anorexia, weight loss, pain at the injection site with possibility of phlebitis or thrombophlebitis. Drug-drug interactions. Patients who are taking amphotericin B should not take other nephrotoxic drugs such as nephrotoxic antibiotics like the aminoglycosides or anti-neoplastics, cyclosporine, or corticosteroids unless absolutely necessary. Nursing considerations. Obtain a culture of infected area to make an accurate determination of the type and responsiveness of the fungus. You're going to do culture and sensitivity. You're going to teach the patient to take the entire course of antifungals. You're going to monitor the IV site. Monitor renal hepatic function before, so we can get a baseline, and then during therapy. Provide safety precautions such as side rails, assistance with ambulation if they're experiencing dizziness, weakness, analgesic for headache, antipyretics for fever and chills, temperature regulation for fever. Teach them small, frequent meals. Make sure you're paying attention to nutrition status. Provide the following teaching: change position slowly, avoid driving or operating heavy machinery. Teach them to report sore throat, unusual bruising or bleeding, yellowing of the eyes or skin, all of which can indicate hepatic toxicity. Report severe nausea, vomiting, which can interfere with nutritional state and slow recovery. Now we're moving on to topical antifungals. Some antifungal drugs are available only in the topical forms for treating a variety of mycoses of the skin and mucous membranes. Some of the systemic antifungals are also available in topical forms. Fungi that cause these mycoses are called dermaphytes. These diseases include a variety of tinea infections. When you see tinea, think fungal. Okay? Tinea infections, which are often referred to as ringworm. These mycoses include tinea infections such as athlete's foot, that's your tinea pedis, jock itch, that's your tinea cruis, and yeast infections of the mouth and vagina, often caused by candida. Ketoconazole, treats seborrheic dermatitis, tinea corporis, tinea curis, tinea pedis. Contraindications and cautions. Remember, these are topical drugs. Because these drugs are not absorbed systemically, contraindications are limited to known allergy to any of these drugs and open lesions. Because guess what? If it's a topical medication and the patient has an open lesion, don't you think that medication is going to be absorbed much more quicker than we wanted it to? So we got to be careful. Econazole can cause intense local burning and irritation and should be discontinued if these conditions become severe. Sulfonomide should not be used for longer than how long, guys? 6 weeks. Sulfonomide should not be used for longer than 6 weeks. Adverse effects. When these drugs are applied locally as a cream, lotion, or spray, local effects include irritation, burning, rash, and swelling. Nursing considerations. You're going to instruct the patient in the correct method for administering depending on the route. Troches should be dissolved slowly where? In the mouth. Vaginal suppositories, creams, and tablets should be inserted high into the vagina, with the patient remaining recumbent for at least 10 to 15 minutes after insertion. So after insertion, can they immediately get up and go to the bathroom? No. Topical creams and lotions should be gently rubbed into the affected area. Occlusive bandages should be avoided. You're going to teach the patient to stop taking the drug if severe rash occurs, especially if it's accompanied by blisters or if local irritation and pain are severe. Provide the following teaching. You're going to teach them. You guys see I have stars next to this. I put NCLEX next to it. You better know it. Use clean, dry socks when treating athlete's foot to help eradicate infection. Fungus loves moist, nasty, dark environments. So those, it's called athlete's foot because most athletes, they sweat, right? So they sweat, they don't, or people who work out, they go work out and that sweat is just sitting on their skin and they don't bathe immediately after, and fungus can start to grow. So to wear clean, dry socks. The need to keep the infected area clean, wash with mouth soap and water. Look, pat dry, not rub dry, pat the area dry. Avoid scratching the infected area. Use cool compresses if itching is a problem. Avoid occlusive dressings. Key points. Local fungal infections include vaginal and oral yeast infections, tinea infections, athlete's foot, jock itch. Proper administration of topical antifungals improves their effectiveness. They should not be used near open wounds or lesions. So when you're applying these topical medications, guys, before you apply, you have to check the skin and make sure that it's intact. Topical antifungals can cause serious local irritation, burning, and pain. The drug should be stopped if these conditions occur. Summary. Any infection with a fungus is called a mycosis. Systemic fungal infections, which can be life-threatening, are increasing with the rise in the number of immunocompromised patients. Because systemic antifungals can be very toxic, patients should be monitored closely while receiving them. Adverse effects may include hepatic and renal failure. Local fungal infections include vaginal and oral yeast infections, the candida, and a variety of tick infections, including athlete's foot and jock itch.
What is that?
The tinea curis.
Oh.
Proper administration of topical antifungals improves their effectiveness. They should not be used near open wounds or lesions. You guys need to make sure that that skin's intact before you apply the topical antifungal. Topical antifungals can cause serious local irritation, burning, and pain. The drug should be stopped if these conditions occur. And that's the end of this chapter.